Welcome Joint Chiropractic employees to your 2025 benefits open enrollment. I'm Bernard Rubenstein, Managing Director of Franchise Benefit Solutions. I'll be guiding you through the presentation, during which we'll cover several key topics, including welcome and introduction, your benefits, your way, understanding your program, who qualifies for coverage, 2025 benefits review, your enrollment process, and how to contact us should you have any questions. The Joint Chiropractic offers a customized benefits package enabling you to design your own plan, to choose benefits that fit your own needs and your budget. The Joint Chiropractic has set a contribution level. The rest is up to you. You decide what you can afford. Through payroll deduction, choose from 3 health plans: dental, vision, telemedicine, supplemental health plan, voluntary life, accident, critical illness, hospital indemnity, short-term disability, pet insurance, legal, and identity theft and fraud protection. The contributions you make towards your employee benefit plan are deducted on a pre-tax basis. This automatically reduces the net cost of these benefits to you by lowering your taxes and increasing your spendable income. Eligibility. Let's take a look at who can enroll. Employees working at least 30 hours a week, legal spouse or registered domestic partner, and children under the age of 26. When can you enroll? You can enroll within 60 days of your date of hire, during annual open enrollment, and within 31 days of a qualifying event. Let's take a look at the benefits and offered and who it's offered through in 2025. Health insurance is offered through United Healthcare and a supplemental SBMA multi-plan. Dental is through MetLife. Vision is through VSP but administered through MetLife. Life insurance is through MetLife. Telemedicine is through Recurral Health. Accident, critical illness, and hospital is through MetLife. You have 3 medical plan options through United Healthcare. All 3 are major medical plans, and all 3 are PPO plans, which means you do not need a referral from your primary care physician to receive care from network and out-of-network providers. The Choice Plus is a national network, so you can go to any provider within the network and out-of-network across the country. Option 1 has a $6,000 individual deductible, $12,000 family deductible in network, and $10,000 individual, $20,000 family out-of-network deductible. Coinsurance is 30% after your deductible in network, up to $8,000 individual, $16,000 family. Out-of-network is 40% after $10,000 deductible individual, $20,000 family, up to $30,000 individual and $60,000 family. And again, being that it's a Choice Plus network, which encompasses the largest network across the country, most providers are going to be in the network. Again, office visit in network is 30% after deductible. Out of network is 40% after deductible. Routine preventative services are covered 100% in network, 40% after deductible out of network. Outpatient diagnostic lab and x-ray is 30% after deductible in network, 40% out of network. MRI, CT, and PET exams, which is major diagnostic testing, is 50% in network after deductible, 40% in out-of-network after deductible. Outpatient surgery and inpatient hospital stay, 30% in-network after deductible, and 40% out-of-network after deductible. Emergency room, 30% in-network after deductible, as well as 30% out-of-network after deductible. Urgent care, in-network is 30% after deductible, and out-of-network is 40% after deductible. Prescriptions, all copays are after the medical deductible. Tier 1, which is generic, is a 15 copay after the medical deductible. Tier 2 is brand, $50 copay after medical deductible. Tier 3 is $150 copay for non-formulary after the medical deductible. And Tier 4 is a $500 copay after medical deductible, and that's for specialty drugs. One thing to note for option 1 as well as option 2, both plans are health savings account, which means you can set up a savings account to pay for your medical expenses. You can set up the account pre-tax and use the money that you put into the savings account pre-tax at the time that you need to pay for your services. Option 2 here, again, you do not need a referral from your primary care physician to receive care from in-network, out-of-network providers. Option 2, deductible, $3,500 individual, $7,000 family in-network, and $7,000, $14,000 out-of-network. Coinsurance, which again is after the deductible of $3,500 individual, $7,000 family in-network, is 20% up until you reach $7,500 individual and $9,100 family in-network, and 50% after $7,000 individual, $14,000 family, up to $20,000 individual and $30,000 family out-of-network. Your primary care physician is a $30 copay after deductible, and specialist is $90 copay after deductible. Both are in network. Out-of-network is 50% after your out-of-network deductible. Preventative services are covered 100% in network, 50% after the deductible out-of-network. Outpatient diagnostic and lab and x-ray, 20% in-network after deductible, and 50% out-of-network after deductible. MRI, CT, and PET exams is in-network, 50% after deductible, out-of-network, 50% after deductible. Outpatient surgery, 20% after deductible in-network, and 50% after deductible out-of-network. Inpatient hospital stay, 20% after deductible in-network and 50% after deductible out-of-network. Emergency room, both in-network and out-of-network, are 20% after deductible. And urgent care, in-network is a $50 copay after deductible in-network, and then out-of-network is 50% after deductible out-of-network again. Prescriptions, generic is a $10 copay after medical deductible. Brand, $40 copay after medical deductible. Non-formulary, $150 copay after medical deductible, and specialty drugs, a $500 copay after medical deductible. Again, both option 1 and 2 are a health savings account where you can set up a savings account to pay for your medical expenses. If you wish to set up a HSA for both or either one of the two plans, please reach out to me and my contact info will be at the end of the presentation. And finally, option 3 is also a PPO. You can visit any provider in network or out of network without a referral. This plan has a $1,500 individual deductible and a $3,000 family deductible. Out of network is $4,000 individual, $8,000 family. Coinsurance in network is 20% after your $1,500 individual, $3,000 family deductible, up until you reach $7,500 individual and $15,000 family. Out of network is 40%. You pay after the $4,000 individual, $8,000 family deductible, up until you reach $12,000 individual and $24,000 family. Office visits in network is a $30 copay for the primary care physician and $60 copay for specialist. Out of network, 40% after deductible. Routine preventative care in networks covered at 100%. Out of network is 40% after deductible. Outpatient diagnostic lab and x-ray, 20% after deductible in network and 40% after deductible out of network. MRI, CT, and PET exams are covered 50% after deductible in network and 40% after deductible out of network. Outpatient surgery and inpatient hospital stay both have 20% after deductible in network and 40% after deductible out of network. Urgent care facility is a $75 copay in network and 40% after deductible out of network. Retail, pharmacy, prescription drugs, $10 copay for generic, $40 copay for brand, $150 copay for non-formulary, and $300 copay for specialty drugs. Option 3 is not an HSA, and you simply have deductible coinsurance or copays. Now, when it comes to dental, you will have the option of 2 plans. Both are similar. Option 1 and 2 both have a $50 individual deductible, $150 for the family. Benefit maximum for option 1 is a $1,000 benefit maximum. Option 2 is a $3,500 benefit maximum. Both plans have 100% coverage for preventative services, basic 80%, major 50%, and orthodontia 50%. However, option 1, lifetime maximum is $1,000 for orthodontia, and for option 2 is $2,000 lifetime maximum for orthodontia. Vision, you're offered 2 options, and again, both options are similar. Option 1 and option 2 both have a $10 copay for eye exams. Option 1 for lens and frames or glasses has a $25 copay once every 24 months or 2 years, while option 2 is a $25 copay once every 12 months. Contact lens can be purchased instead of prescription glasses. In addition to visiting your ophthalmologist or optometrist, you can also visit retail chain providers such as Costco, Sam's Club, and Vision Works. Supplemental life, you can select up to $500,000 as the employee or 5 times your annual salary up to a maximum of $500,000. Guaranteed issue up to $150,000. If you wish to purchase more than $150,000, you will have to answer health questions. Spouse, you can purchase 50% of the employee amount maximum of 100,000, guaranteed issue up to 50,000. And if you wish to purchase above 50,000, again, you will have to answer health questions. Dependent children, maximum is 10,000 in increments of 2,000. Evidence of insurability will not be required when first eligible up to the guaranteed issue amount. Again, excess of the guaranteed issue amount, you will have to answer health questions. MetLife can reject you if you have a health condition that they feel you're not insurable. Telemedicine is through Recuro Health. Let's say you're at work and you get something in your eye and you're not able to visit your primary care physician. You would call the doctor, provide them with your symptoms, and they'll give you a diagnosis and even call in a prescription. You can connect by phone, video, or app, and it's unlimited use for all family members up to a total of 5. Doctors can treat many medical conditions, including cold and flu, allergies, bronchitis, sinus problems, ear infection, and much more. If you're not able to afford the United Healthcare major medical plan, you can select one of the supplemental health plans. There's a Prime Care MEC plan and also a Elite Care MEC plan. The Prime Care MEC plan has no deductible. Routine preventative care is covered up 100%. Primary care visits is a 15 copay up to 3 visits per year. Specialist urgent care, lab and x-rays, and telehealth are not covered. Prescription drugs are covered. Tier 1 is a 15 copay, 30 copay for Tier 2, 50 copay for Tier 3, and 75 copay for Tier 4. Non-preferred brand drugs are not covered, as well as specialty drugs. Option 2 offers more coverage. Option 2 also, the Elite Care does not have a deductible. Routine preventative care is covered 100%. Primary care, 15 copay, as well as specialist. Urgent care, lab, and x-ray services are covered at a 50 copay. Telehealth is included. Prescription for option 2, the Elite Care, is the same as Prime Care MEC, 15, 30, 50, and 75. Now again, I want you to make note that the plan here, both plans, the Prime Care and the Elite Care, only cover the services that are outlined on the screen. Inpatient, outpatient, and emergency is not covered. However, the next plan I'm going to show you is a hospital indemnity that you can package with one of the 2 MEC plans to offer you some type of medical coverage, inpatient and outpatient, possibly quite a bit lower than the United Healthcare major medical plan. So again, you have the choice of the United Healthcare major medical plan or the supplemental MEC plan, and you can also package it with the hospital indemnity. The hospital indemnity offered 2 benefit options, covers both injuries and sickness. Benefits paid for inpatient and outpatient medical treatment received in a hospital emergency room and physician's office. Additional benefits include surgery and anesthesia services, major diagnostic exams, rehab facility, and chiropractic visits. Accident coverage covers accidental injuries regardless of any other insurance. Benefits for both inpatient and outpatient treatment. Covers more than 50 benefits, including hospital admission, hospital confinement, ambulance, emergency room treatment, physical therapy, in addition to the services of inpatient and outpatient. The plan will pay lump sum for fractures and dislocations. So the accident is a pretty good benefit. And again, it pays for inpatient and outpatient treatment, and also for it'll provide you or pay you for fractures and dislocations. Critical illness pays lump sum benefit upon critical illness diagnosis of over 20 different illnesses. Employees offered a choice of 10,000 or 20,000 benefit amounts. Spouse dependent children offered a 50% of employee benefit amount. Critical illness benefits are payable, and this is only a few of the 20. Cancer, heart attack, kidney failure, major organ transplant, Alzheimer's disease, Parkinson's disease, and multiple sclerosis. Short-term disability, you can select up to $1,500 or 60% of your pre-disability earnings, not to exceed $1,500. Benefits will begin on the 15th day. Basically, it's after 14-day accidents and 14-day sickness, or begins on the 15th day. Benefit duration is up to 26 weeks. We get many calls regarding when the benefits begin, and are a bit surprised when the benefits begin on the 15th day. So just in case you forget, benefits do begin on the 15th day for both accidents and sickness. So let's talk about how to enroll. You will receive a link from our EASE portal. It might be from Franchise Benefit Solutions, EASE portal. You will be asked to access the web enrollment. Once you register, you'll verify your personal information, add dependent information, begin the enrollment process. For each benefit, you will need to choose your coverage level or waive your coverage. So it's either one or the other. You will continue until your enrollment is complete, and then you will be asked to e-sign your enrollment form. If you are not asked to e-sign your enrollment form, that means you missed one of the benefit coverage levels. You will then be asked to go back to that level and either enroll or waive. Once again, when you get to the e-sign your enrollment form, if you can e-sign it, that means you have completed the enrollment process. Deadline is December 10th. So the open enrollment will begin on November 25th and end December 10th. So again, December 10th is your end date. We cannot go past your end date. If you have any questions regarding benefits or enrollment, please contact first your management team. They may be able to answer any questions. If they're not able to answer, you can reach out to myself. My email and phone number is listed on the screen. I want to thank you for participating in the 2025 benefits open enrollment. Have a great rest of your day.